You know how sometimes you hear two medical terms and think, wait, are those the same thing? Well, today we're tackling a classic mix-up that trips a ton of people up, cirrhosis and psoriasis. They sound almost identical, right? But one can be life-threatening and the other is a skin condition. So let's solve this medical mystery once and for all.
So here they are side by side, cirrhosis and psoriasis. They sound so similar, but honestly, they couldn't be more different. So first things first, let's just nail the pronunciation. It's cirrhosis, and the other one is psoriasis. Notice that silent P at the beginning. Getting that part down is like half the battle right there. Okay, so here's the big question. One of these is a really serious disease that affects an organ inside your body. The other is a long-term condition that shows up on the outside, right on your skin. So before we dive in, just take a quick guess. Do you know which is which? All right, let's find out if you're right. We're going to start our investigation by looking inside the body. Our first case file is all about cirrhosis, which is really a story about the liver and its scars.
So what exactly is cirrhosis? Well, in the simplest terms, it's what happens when the liver gets damaged over and over again for a long time. Instead of healing properly with new, healthy tissue, it starts to form permanent scar tissue. And all that scarring makes it really hard for the liver to do its super important jobs, like cleaning your blood. So, what causes this? Usually, it's things that put a ton of stress on the liver for years. Things like heavy alcohol use, or certain viruses like hepatitis B and C. In the beginning, you might just feel kind of tired or notice you bruise really easily. But a major sign that things are getting serious is jaundice. That's when your skin and eyes start to turn yellow because the liver just can't keep up with filtering out waste products. And this is the really critical part. Cirrhosis isn't just some minor inconvenience. It can absolutely be life-threatening. That scarring is permanent, and let's be blunt, you cannot live without a working liver. It's a very serious condition.
Okay, let's close that case file and open up our next one. We're shifting our focus now from the inside of the body to the outside. We're now looking at the skin's signals and the story of psoriasis.
Now, psoriasis is a totally different ballgame. It's what's called an autoimmune condition. That basically means the body's own defense system, the immune system, gets its wires crossed and starts attacking healthy skin cells by mistake. This sends a signal for the body to make new skin cells way too fast, and they just start piling up on the surface. The root cause is usually genetic, it can run in families, but it's often kicked off by certain triggers, like a stressful event, an infection, or even just cold, dry weather. And that's what leads to those classic red patches covered with thick, silvery scales that you might see on places like elbows, knees, or the scalp.
And this brings us to a huge difference in how serious these two conditions are. While psoriasis can be really uncomfortable and sometimes even painful, it's considered a chronic condition, meaning it's long-lasting, but it is rarely ever life-threatening on its own. It's something people learn to manage throughout their lives. All right, now that we've looked at both of them separately, it is time for the main event. Let's do a side-by-side comparison to make the differences totally crystal clear. Okay, let's put them head to head. Time to end the confusion for good.
Let's just break this down. Cirrhosis, it's internal. It affects your liver. Psoriasis, external, right there on your skin. One is all about permanent scarring. The other is about skin cells growing way too fast. The causes couldn't be more different. Lifestyle and viruses for cirrhosis versus genetics and your own immune system for psoriasis. And one last really important point, neither one of them is contagious. You can't catch either of these from someone else. So we've totally established that these two conditions are worlds apart, which of course leads to that one final nagging question. Why on earth do they sound so similar? Yeah, let's just ask it plainly. If they are so fundamentally different in every way, why do they sound almost the same? Well, the answer actually lies in ancient Greek. And here is the big reveal. Both of these words share the exact same ending, the suffix osis. This little ending comes straight from Greek. And in medicine, it's just a common tag that means a condition or a disease. That's it. So you'll see tons of different medical terms that end this way. The real difference is in the first part of the word. Cirrhosis comes from kairos, which is the Greek word for a yellowish tawny color, describing the color of a diseased liver. Psoriasis, on the other hand, comes from psora, which is the Greek word for itch. So you really have the yellowish condition and the itchy condition. See?
It all makes perfect sense now, doesn't it?
And this is why getting this straight really matters. Psoriasis is on the outside. You can see it, you can identify it, but cirrhosis is what you might call an invisible illness. It's all happening inside the body. It's so often misunderstood, and knowing what it is and what it isn't is absolutely vital.
So there you have it. One osis, two totally different worlds. And it leaves me with one final thought for you to chew on. What other medical sound-alikes have tripped you up before? Thinking about them is actually a great way to stay curious and keep learning.